In the news tonight, a key player in the Trump administration paid a visit to Lackawanna-County. Dr. Mehmet Oz oversees Medicare and Medicaid services for the White House. His visit to Scranton comes as health care advocates in our area worry about the potential effects of this year's big budget bill on rural hospitals. Newswatch 16's Valeria Quinones is here with more on the roundtable. Valeria.
Scott, Dr. Mehmet Oz and Congressman Rob Bresnahan met with local healthcare officials from around our area to discuss the future of rural healthcare in Northeastern Pennsylvania. Congressman Rob Bresnahan brought Dr. Mehmet Oz to a healthcare roundtable at a Geisinger office building in Scranton. Dr. Oz heads the government Center for Medicare and Medicaid Services. Those services will likely see changes as the so-called One Big Beautiful Bill gradually takes effect. The government has set aside $50 billion to help rural health care providers in our area and around the country navigate those changes.
The 25 of the $50 billion will be doled out equally to every single state, independent of everything else. The second part of that is designed to specifically and be tailored to issues around how rural you are, where your population lives, and a bunch of other variables.
Unfortunately, we are the picture of rural health care that is underserved. It's our role to work with everybody to change that picture and to be a better picture in the future.
There was a humble acknowledgement of we have a really complex debacle in front of us, which is American healthcare, and that the solutions for that are going to be when we have proximity between the oversight and authority of the federal government.
That's where we were able to have meaningful dialogue about what this actually means, and by giving everybody a voice at the table so we know how to best apply and actually utilize these funds so it actually makes a difference.
We didn't want to just give the money out and hope it works. We purposely put strings attached. So if you promise to do certain things and you don't do them, you should be penalized. However, if you do those things and other states don't do what they promised to do, you're going to get their money.
The changes to Medicaid called for in the One Big Beautiful Bill are set to take effect in just over a year. In just about a month, another big health care issue comes to a head. Subsidies that support the Affordable Care Act end, and premiums are expected to go up. Congressman Bresnahan told us that he supports extending these subsidies while adding new reforms. It's not clear right now if any kind of plan will be voted on by the end of this year. I'm Valeria Quinones, Newswatch 16. Scott, back to you.